Good afternoon, everyone. Thanks for tuning in to today's announcement about COVID CARES outreach. I'm Rick Wilson, Minister of Indigenous Relations, and I'm pleased to speak with you today from the Treaty 6 territory. The virus continues to affect individuals, families, and communities. So for Indigenous communities, it's been especially rough lately, with outbreaks in different parts of the province. That is why I'm especially glad to have with me today the Minister of Municipal Affairs, Rick McIver, and Chief Ivan Sawan of Loon River First Nation. Chief Vern Saddleback couldn't be with us today, but he'll be making a news release later. So today, I'm going to turn it over to Mr. McIver to make today's announcement.
Okay, well, thank you, Minister Wilson, and also welcome Chief Sawan. I appreciate you taking time out of your busy schedule to be here with us today. I am happy to be here today to outline how Alberta's government is expanding supports across the province to help limit the spread of COVID-19. In the last few weeks, we've seen a significant reduction in COVID-19 cases across Alberta. We asked Albertans to make the right choices to help limit the spread of COVID-19, and it looks like Albertans are listening. And I think that's reflected in the daily numbers that we've been hearing lately. To each and every Albertan, I say thank you. Thank you for the sacrifices you are making to keep your family, your friends, and your neighbors safe. We've also seen a number of people take advantage of increased outreach programs that Alberta's government is offering. Well, the self-isolation hotel program has been available since May to all Albertans, including First Nations and other Indigenous individuals, both living on and off reserve and people living on Métis settlements who cannot safely isolate in their own home or communities. Today, we're announcing that financial aid is now being expanded across Alberta. This means that upon referral by Alberta Health Services, Albertans who must isolate or quarantine in a designated hotel are eligible for a free of charge hotel room stay for as long as required, but up to 14 days, complete with culturally appropriate food and other supports. They are also eligible for temporary financial aid in the amount of $625 when they have completed the self-isolation. Safe transportation to COVID-19 assessment is also available if required. We must continue to work collaboratively between our province and our communities to protect Albertans and get our economy back on track. The COVID Care Team program launched in December to reach communities with particularly high level of COVID-19 spread. The COVID Care Teams continue to provide on-the-ground support and interventions to limit the spread of the virus. I am very grateful for the support of municipal resources, community organizations, cultural organizations, translators, social workers, faith leaders, and settlement organizations that are helping us ensure we are providing Albertans with the right amount in the best way possible. Since the launch of the COVID Care Teams and outreach campaign in December, more than 850 Albertans have accessed hotel accommodations for self-isolation purposes. Remember, this is serving Albertans that may not get the message about COVID-19 through regular media because they don't necessarily speak one of the two official languages. So this is reaching out to those that we might otherwise miss. Expanding the isolation benefit will help more Albertans keep themselves and their families safe. It's now my pleasure to invite Chief Ivan Sawan to provide more information on supports for First Nations and Métis settlements. Thank you.
Okay, thank you again. I just want to thank the province of Alberta for initiating an incentive program for people that are currently isolating in their homes or in their hotels. So I think this is a tremendous effort from the province to be able to initiate some kind of an incentive while our people are in isolation or tested positive or currently in isolation. So I want to thank the province of Alberta for initiating that. Thank you very much. It's going to alleviate the pressures that are in regards to finances within our communities and within the families. So I appreciate all the incentives that you guys provided. Thank you very much. Thank you.
Thank you very much. We now have a few minutes for questions. I don't think we have anyone on the line yet. We'll just hold that open for a moment.
Our first question is with Lisa Johnson from the Edmonton Journal.
Hi, Minister. I'm wondering if you can just clarify that this program will be available to all Albertans or specifically to those living on First Nations reserves and Métis settlements. And I'm also wondering if, Minister Wilson, you can comment on how Alberta is doing. As of January 29th, Indigenous Services Canada was aware of 5,048 cases on First Nation reserves in Alberta, which is higher than in any other province. So I'm wondering what makes Alberta an outlier in that statistic and why there are so many Alberta communities that have been hit harder than in other provinces.
Okay. Well, thank you for the question. And to be clear, the program is available to all Albertans. But remember, this program came about as a result of community organizations within Calgary and Edmonton initially coming to government and saying, we know which neighborhoods, or we all know which neighborhoods the COVID spread has been higher. And there's a reason for that. It's because people are in living situations where they're not able to self-isolate, sometimes due to the number of people living in a household, sometimes multi-generational households, and also due to the fact that some of the people in certain communities don't speak either English or French. Consequently, mainstream media doesn't always reach them. So we've had people going out through community associations, through ethnic media, radio and TV stations that are other than English and French, and reaching out to those people that aren't getting the message in mainstream media. And it's turned out we've identified a number of people that we've been able to help, and they've been able to, if they can't self-isolate in their own home because of the living circumstances, we provide a hotel room for them to do that, along with food and the accommodations that they need, and a living allowance to make that possible. So this is expanding a program that was started in Calgary and Edmonton that people brought to the government. It's expanding it across the rest of the province because we know there's areas in the rest of the province where it's needed. And some of those areas, of course, include First Nations and Métis settlements that, in the same way, sometimes through multi-generational families and such, people with COVID are not always able to self-isolate. So this helps us get to solve that situation.
Yeah, I could just follow up on that. Thank you, Minister. And you're 100% right on. Living conditions are sometimes strained. You have multi-generational families living together, and so it's hard to isolate. So this program is really going to allow them to still be able to have that support and those take their family members that are suffering from COVID and isolate them from the rest of the family. We've seen this right across Alberta, and the chiefs have been Chief Salwin here has been doing an amazing job up in his area, looking after his people to make sure that they are safe, and I'm seeing that right across the board. But they do need this little extra help, and this is going to make a big difference, this program, so thank you for doing that.
Thank you. We now have our next question on the line.
Next question is Catherine Grukowski with Alberta Today. Go ahead, Catherine.
Good afternoon. Thanks for taking my question. Looking at the provincial data set, it appears that cases among First Nation people didn't start to really increase until October and November, and I'm wondering, was there any one factor that's attributed to? What has changed since the first wave?
Well, I think, a lot of part of it is, of course, with the colder weather, people are moving inside and congregating in multi-generational houses. So instead of just having 4 or 5 people in a household, you could have 15, 16 people living under one roof. So if one person does get it, it can spread fairly fast throughout the community. And by doing this program, it's going to help a lot. Like I say, these people can now have the support they need, be isolated, and still have some financial support to help them out because they don't have the financial means to do this. So like I say, it is going to be a great program, and that's probably one of the bigger reasons, just due to weather conditions and people isolating more.
Thank you very much. We now have our next journalist on the line.
Next is Kenny Trenton with Kix FM. Go ahead, Kenny.
Thank you for taking my question. My question is actually for Chief Ivan Sawan. It's right in our broadcast region, and I guess already both Minister McIver and Minister Wilson both kind of answered the question about the challenges, but just so some of us can get an idea, what specifically are some of the challenges that COVID has brought to the Loon River First Nation?
Okay, great question. So one of the challenges is overcrowded issues. So we have 10 to 15 people living at one location, which is one of the houses. So we have various houses that have overcrowded issues. So that's been one of the main challenges within our communities. And other than that, that's been the primary reason why the spike of the COVID-19 within the First Nations communities is trying to keep our people safe and from COVID-19 has been a challenge itself. But with this initiative, with the incentive, I guess, the incentive of the province that are doing right now is it's going to alleviate some of the pressures that our people are able to isolate in a hotel. So thanks again.
Thank you very much. We now have our next question.
Next is Brian Lappy with CBC. Go ahead, Brian.
Hi there. Minister McIver, I just wanted to know more about the decision to offer this program to cover the cost for people who have to, quarantine in a hotel. What was the rationale for that? Obviously, the federal program is intended to discourage foreign travel. Are you concerned that this could send the wrong message if the government is offering free accommodation for these folks?
Well, I certainly hope not. Here's what you need to know. This program has nothing to do with the federal program, and the federal program has nothing to do with this program. And that's not a criticism of either one. They're two separate programs for two separate reasons. This program is not about travel. This program is about people living in Alberta that, should they get COVID, are unable, because of their living circumstances, to self-isolate. And this now makes that possible. And that's because in many cases, a large number of people living in a home through multi-generational families, or for whatever other reason, there's many people living in a home. And the other opportunity that this COVID care teams helps, again, that started off in Calgary and Edmonton, but now we think it's working, so we want to offer it across the province, is that people that may not get the message through your media outlet, and I'm not criticizing you either, but your media outlet is primarily in English and French, the two official languages, and many Albertans don't speak English or French. So this is a way to get the message out beyond that to people that need to know how to sanitize, how to self-isolate, all the things that we've been driven crazy with. Wash your hands, all the advice we've been getting for a year now. But if people don't speak the language where the advice is given, then they don't necessarily get the message. So this actually reaches out to those people that might not otherwise be reached, and also provides people, no matter what language they speak, to self-isolate if indeed they live in a household where there's no opportunity to self-isolate within the place where they live. So it protects them. It protects the people that they're living with from being spread within the household, and protects the wider community from having the greater spread within the community that can't necessarily be contained. So we believe it's having it's had a positive impact in communities where it's needed in Calgary and Edmonton, and that's what a great reason to provide that positive opportunity to Albertans outside of the two major cities.
Thank you very much for our questions today. That concludes the press conference.